Namaskar, sir. Can you hear me now?
Namaste. I'm good. How are you?
I'm good, sir. Namaskar, Dr. Sharon.
Yeah, hi Shivani.
How are you?
Good, good, good. How are
Thank
you?
you. Good, good. Thank you so much for confirming for today's IG Live. It's so wonderful to have you and enlightening us, educating us, awareing us, because there's a lot of content on preventive care, but not a lot of people, not we do not have a lot of content to educate ourselves on palliative care. So let's start with you, Dr. Sharon. Why don't you give us a brief introduction about how Ayurveda's role and creating that differentiation in preventive care and palliative care with Ayurvedic perspective?
Okay, so creating a difference.
Ayurveda's role in preventive care and palliative care. Not even difference,
Yeah,
but what is
yeah,
Ayurveda's role?
yeah. Because it is different. Everywhere preventive and palliative care is different. So of course, Ayurveda also looks at it differently. So when we look at preventive care, there is the emphasis, I would say, Ayurveda is most commonly known as a preventive medicine. Like people look at it as a preventive medicine, which is true, but the weightage given to preventive medicine and palliative care in Ayurveda is 50-50. So while we have an entire segment of the text speaking about preventive care, as in how to, starting from the time you wake up to the time you go to bed, and also what happens during your sleep, the whole of it, and not just you as an individual, but your interaction with the people around you, your family, your society, the country you're living in, the kind of food you eat, how you choose to interact, all of these things are covered under preventive care. And preventive care plays a very major role, which we all are learning now. Now, preventive care in modern medicine is taking, now that is why now we're purchasing a lot of preventive care stuff online. But Ayurveda has been talking about this all the while, which is why Ayurveda is famous for preventive care. But the sad part is not many know that palliative care is also taken seriously. You cannot just prevent diseases and leave the patient like that. It's
Absolutely.
your responsibility as a physician to also handle when there is a disease condition, which it would be crazy to think that Ayurveda doesn't talk about it. So yes, there is a lot of emphasis on preventive care, but there's equal emphasis on palliative care as well. And yes, we have a lot of description, and we have been working on it too. So yeah. Yes.
Dr. Pankaj, would you like to add something more about palliative care? Because you have been working closely with senior citizens a lot, and not only in India, but you have been managing patients worldwide. So please share some insights on it.
The basic gist of Ayurveda is Swasthasya Swasthya Rakshanam Aturasya Vikar Prashanam Cha. So it is preventive care and palliative care combined together. So when you understand the constitution of the person, so every constitution has disease prognosis actually. So if you are a pure Vata, there are few diseases that can happen to you in older age or in later stages of your life. So when we understand the constitution and start taking preventive care measures so that the balance of energies are there and we can delay the disease process or reduce the symptoms to bare minimal basically. So in same way, it prevents from any major disease to set its roots if followed properly with, as Dr. Shannon also said, Dinacharya, Rutucharya, from the time you wake up till the time you go to bed, all small tips are there in Ayurveda how to keep up with your biological clock, eat proper things at proper time, proper combination, the Viruddha and also all that guidelines are there in Ayurveda for preventive care. When comes palliative care, there are multiple dimensions in Ayurveda about herbs, combination of medications, panchakarma and all, which can improve the life of a person, reducing the symptoms to a very lesser level. Uh, there are cases where diseases have been reversed also. So Ayurveda works in both parameters. It depends on when you start practicing Ayurveda. Once you fall sick and then you start following the Ayurveda, then it is palliative care. If you know that you want to stay healthy for a very long life, then you start early and do the preventive care.
Absolutely, very well said, Dr. Pankaj. But let me put this question this way: that and because we are talking here about palliative care, so there are a lot of now the person is not suffering from single disease. When I'm talking about palliative care, there's a lot of comorbidities attached. The how Ayurveda approaches such kind of complex diseases.
Yeah. So, in Ayurveda, basic understanding of the root cause is very, very important. So, in Ayurveda, it is mentioned that the cure to your disease is your history, actually. So nowadays, doctors are skipping this major integral part of diagnosis. Actually, they are not doing the history taking properly. So they just understand the symptoms and then move ahead with the treatment and all. So, but if you go dig deeper in later years of age, how you were in younger age, how you were in childhood age, so your cure is in your history, from where the thing starts getting bad and the diseases start developing basically. So like in Ayurveda, there is a concept of samprapti. So in samprapti, it is like sanchay, prakop, prasar, then there is accumulation of imbalances that starts happening, and then multiple tissue system starts getting affected, which is a like comorbidities starts happening. So when we start treating the root cause, gradually the symptoms reverse also, and the multiple tissue systems which are getting affected starts getting better and better, and the quality of life also increases.
So, Dr. Pankaj, I think with that ways we need a lot of patience. We need a lot of patience and a lot of trust to the Ayurveda system of treatment. So here I have another question now, and I request Dr. Sharon, why don't you share your insights on it? That now, like for an example, this is like COPD or heart attack or stroke. In those cases, there is no cure. Now here, how Ayurveda shifts its focus from there, as there is no cure, how Ayurveda shifts its focus to improving the quality of life.
Mm. See, when we speak about multiple symptoms occurring together in one illness, we were talking about that. So the whole idea of Ayurveda itself is to not segregate individual symptoms. You do that, yes, but you also look at the person as a whole. So because there is a clear definition that you don't really need to name a disease to be able to treat it. So you
Mm-hmm.
don't keep waiting to be able to name the disease and to start treatment. When you start identifying issues, you put the pieces together and then you start your work. And so in cases like the ones that you were talking about, like chronic conditions, which occur after a long period of time, it is like sir was saying, it is it's like a combination, like it pulls together Chaya and then Prasara, Prakopa. It comes together and then it piles up into one disease condition. So we don't wait for it to completely manifest here. So we start implementing Dinacharya, Rutucharya very strictly with a lot of discipline, such that these conditions, when they manifest, see, even in such, you said it's not treatable, it cannot be treated, but it doesn't manifest the same way in all individuals. People who have better capacity, better strength in the body, also by genetics or by virtue of their lifestyle or best in combination of both, have better capacity to fight off these conditions as well. So what we look at is one, to improve the gene pool such that the next generation doesn't carry these conditions forward. One. Second, correct the lifestyle right from the beginning so that what they when because we don't wait till old age, we don't wait for the condition to manifest to start treating it. We start telling it's going to happen at some point. Watch out for it. Watch out for it such that it doesn't happen. And when it happens, also, it's not about giving up and saying that there is no response, there is nothing that you can do about it. Because, again, like Sir said, there have been reversals as well in certain conditions, not in all of them, in certain conditions with determination. You can definitely improve the quality of life of the individual. And we've seen that in multiple cases. So, There is no giving up here.
I like your answer is correct with this that there is no giving up, and we look forward with the quality of improving the quality of life when we seek Ayurveda treatment. But here, let me put together this entire as a situation based. Now, for an example, a patient goes to the allopathy treatment and they says that there is no cure here. So
Yeah,
at that point of time, a person wants to get fixed himself, get
yeah,
either get improved or get that disease to be cured. He knows somewhere that the allopathy has said no, and
yeah.
therefore he reaches to the different treatments, different sets of treatments.
Yeah.
So
So, yeah, Shivani, on this note, yeah, because yesterday I had a patient who said the same thing to me, but it's not with respect to heart disease or COPD, but it was with respect to endometriosis. She was a 35-year-old girl, unmarried, sitting there in front of me saying that it's been 5 years that 3 days of her cycle, she starts vomiting on day one. She keeps throwing up bile. Sometimes it's even blood, and she's been doing that for 5 years every consecutive cycle. And this doesn't come under the conventional symptom of dysmenorrhea, dysmenorrhea, which is painful cycles, which is one of the conventional symptoms of endometriosis. So no doctor is able to treat her. So she says, I am given this, and I'm given antiemetics every time I go there, and I'm given antacids, and I don't want to take it anymore. Can you help me? And she's crying there. So I'm just asking you, imagine this scenario where they're coming to us asking for treatment. And this is one of the simplest things that we can cure with Ayurveda. Not endometriosis. Endometriosis is complicated, but this particular symptom that she's been suffering with, that she's not able to eat for 3 days, throws up consecutive, that as is it's not able to go to work. Is just 35 years old, supposed to be living the best of her life. But this symptom is not considered to be something that requires attention because it's just vomiting after all. But how much it can affect the quality of life of that individual, a sensitive doctor will know. A sensible doctor will know. You don't have to be sensitive also. A sensible doctor will know that. So this is something that I was thinking we can definitely bring improvement in these areas of life. So this is one thing that I just saw yesterday. So I'm telling you about it. But yeah, we can definitely bring a response that we should. I mean, this is what we are specialized in.
do you have something to add on this, Dr. Pankaj?
Yeah, definitely. When in diseases are also categorized in Ayurveda as Sukhasadhya, Kashtasadhya, and Asadhya, basically. So treatment pattern, preventive care, and how to improve the quality of life is mentioned accordingly. So when it is a Asadhya Vyadhi, we don't really focus about on the Vyadhi per se. We will focus more upon the symptoms which are bothering the most. So we try to improve and rebalance the dosha or the energy imbalances basically, so that the symptoms are bare minimal and bearable basically, and quality of life is increased. So in such cases, from neither preventive nor palliative, it is more care based help basically that the Ayurveda can provide through multiple kind of herbs are there. Then some very nice herbal teas are there which can help and assist with common day-to-day symptoms which complicated or like asadhya vyadhi can bring in on a day-to-day basis. So
Right. Yeah.
most of
So
your
you would agree, I mean, and just to cut you there, you would agree that there is no preventive or palliative, right? Like we're
yeah,
always doing preventive and palliative, right? I
yeah.
mean, I just, because yeah.
Yeah, yeah. So that's what. So and most of your treatment is in your kitchen itself. So all the, especially Indian kitchen. So Indian kitchens have all the spices and herbs that we keep used in cooking, which can play a magical, remarkable role in reducing the symptoms very quickly and improve the quality of life. If the person who is suffering from some symptom which allopathy or any other modern sciences have denied to address basically because of impossibility, an impossible treatment basically. So in that cases, few simple herbs and home remedies can work remarkably here. So improve the quality of life and introduce care factor as a treatment. So that will support the person in totality.
So that's beautiful to put it together that there is no such thing preventive and palliative, but the care has to be in totality in such a way that it offers care, a good quality of life. By good quality of life, we meant to say care, care treatment. So if I put, okay, here I have a question for you, Dr. Sharon. In one of our IG live a few months back, you mentioned that how Ayurveda is also symptomatic, that there are treatments, there are medicines, herbs that can address symptoms. But here I am talking about advanced stage of illness. Now, if a patient comes that they have a lot of pain and they have been consuming painkillers, and I'm just mentioning this because this happens commonly, that people just think about that there is no way to address this disorder or disease. Let me consume painkillers, and they just keep consuming painkillers. So, does Ayurveda has answer to it? That can they give a pain relief or anxiety relief
Okay.
in advanced stages of illness?
So on this note, I would say, see if there, like you're talking about an advanced case of, like for instance, CA, okay, cancer, where the pain is severe and they have to take a painkiller. There is, I am not against, let me tell you, I'm not against taking an analgesic because why suffer? Why suffer? This is made to help mankind. Why suffer?
Right.
But the thing, what I see there is when the patient is in constant pain, only an analgesic also doesn't do anything. Giving an analgesic alone, if you say, okay, an analgesic might bring down the pain temporarily, in such cases, it might bring it down by 50%, but remaining 50% of the pain is still there. So in such cases, only an analgesic still doesn't do the trick. You have to provide additional support to the patient. And this support comes in the form of some Ayurvedic medications, of course. Some Ayurvedic therapies also provide relief. Most importantly is bringing into like you said, the anxiety that comes with it, the depression, the panic
Absolutely.
that comes with this condition. When you know you are in that stage of life and nothing is really giving you relief, even a painkiller 4 times, 5 times a day is not giving you relief. That state, ignoring that state of mind of that person is what is the mistake that's happening here. It's not about whether Ayurveda or an analgesic. It doesn't have to be like that, right? You can, like for instance, recently I lost one of our patients to yeah, CA, it was CA cervix. But the thing was that I saw her suffering. She was getting treated at the best allopathy hospital with complementary therapy from our end. I was providing relief in terms of medication, support in terms of diet support, and also her emotional well-being. I saw her suffer every single day, even with the best treatment. So it is. I just wish though that those doctors, because they didn't even want to tell the other doctor that they were talking to an Ayurvedic doctor. But I wish they spoke about it, because if they spoke about it, we could have worked together to deliver something better in the last few months of her life. We could have done something better for her together, because anyway we're going to lose her. So why not make those few months matter to her? That would have been possible if there was an integrated approach from their end as well. Because see, again, that comes as a mainstream treatment there. Fortunately or unfortunately, it has become like that. So they have to also come forth and take our support, because we are here to provide support. So I don't think it's ever about can Ayurveda do this? Because many people ask this. I am in pain. Can't there is a fracture? Can't Ayurveda cure this? What is the Ayurveda cure this kind? If whatever is available in that time to make sure that the bone heals, you do that. You do that, right? With support, integrated support, because we are all coming in with different ideas. And those ideas are all for the well-being of the patient. So long as that's there, so long as the patient is looked at as a person, so long as that person becomes your project, I think I think everything is fine, because that person in pain is all that matters. Everything else is just noise.
Very well said and very well put together, Dr. Sharon. In fact, to all the audience who will be watching this IG Live later also, why we are asking this question, why we are doing this IG Live is not to create differentiation between Ayurveda and different kinds of treatment. No, absolutely not. We are here talking about integrated healthcare system. We are talking about integrated system where we talk about holistic wellness, where we support longevity with all kinds of treatments. So by promoting Ayurveda, it's not that we are discouraging any other treatment. Absolutely not. And very well said by Dr. Sharon that if that patient, if that person has mentioned about that how this person is also seeking Ayurveda to improve the quality of life, it would have given somewhere a conscious answer to a lot of systems that are existing, that if we integrate alternate systems or different other systems, it might help us to look at the person not as a patient but as a project to cure or to treat. So thank you, Dr. Sharon, a very insightful answer. Here I have a question with you, Dr. Pankaj, that in your like until now, in your span of treating people, curing people, healing people, have you ever seen that with the help of Ayurveda, you were able to see, stop, slow down the progression of any disease or stabilize the disease in palliative care?
Yes, in many cases, and I would say most of the cases actually, slowing down is definitely is happening. Reducing of symptoms happens immediately once you change the eating patterns and combinations of food and all. You introduce some herbal teas and all. So that definitely happens. And reversal also happens, as I said before. Also, like many diseases like diabetes, even blood pressure, thyroid, these diseases can be reversed because these are all lifestyle related disorders. And through palliative care also and through preventive care as well, improving the lifestyle, improving, introducing right kind of food combinations and proper following routine as per the season, as per the biological clock, and your body heals itself, because once you correct the lifestyle, these diseases can be reversed. Obesity is one of the biggest lifestyle disorder, basically, where there is definite 100% reversal. When you correct your eating pattern, your mind also changes, your confidence level also changes, and a person becomes a new person in totality. So there is a saying that, and proven by medical science also, that life of one cell of your body is 120 days. Actually. So if you stick to a discipline for 120 days, the next generation of the cellular system will be much more healthier. They have a better oxygen carrying capacity, they have better nutrition absorption capacity, and the entire genome changes actually. So when you do that, your reversal is definitely going to happen, because you will be breeding a stronger generation of cells. So your body stops from degenerating and start improving on the health wise as well. So that is what Ayurveda is all about actually. To suggest discipline as per your constitution, as per your imbalances, and look for the root cause of the disease or the symptom that is bothering. So that is important. Yeah.
I absolutely agree with you here, Dr. Pankaj. In fact, here in yoga also, the discipline is one of the pillar, the swadhyay is one of the pillar, and to achieve anything in life, be it your good health or be it your mission to be accomplished, you need discipline. But I have a question here with you, Dr. Sharon, that you have been closely working with women. So, have you encountered any such episode where, with the help of Ayurveda, and here I'm not talking about any extreme disorder. I'm here talking about something which is like which can be as simple as complex as endometriosis also. But tell me something about how Ayurveda has helped in slowing the progression of any disease.
So one of my success cases is this woman with fibroids. So she was 47 when she came to me, and multiple fibroids. So each one, there are 5 fibroids indenting into the endometrial cavity, such that the cavity itself is not visible. It's huge, and heavy bleeding, bleeds for almost 15 days, a month, severe pain, losing weight, and the only option was given was surgery, which is understandable, but at the same time, she wanted to give it one because she knew she's 47. She knew she's going to menopause in another few years. She wanted to see what best can be done to at least stop this fibroid from going further disease. So, is this a problem? Is this? Would you call this as a condition that requires palliative care? I don't know, but yes, because it is significantly affecting her quality of life on an day-to-day basis. So yes, So this case, I gave her a time limit of 6 months that we're going to see what's going to happen, because you can't blindly keep treating without observing whether it's getting worse or not. So we took a 6 months timeline for us, and we of course kept monitoring every 3 months. We did an ultrasound to figure out. We had the previous ultrasounds as well, which showed that the size of the fibroid was increasing with every subsequent ultrasound. So this was going to be a first challenge to ensure that the fibroid doesn't increase in size once we start the treatment. So she happened to be a wonderful patient who stuck to the rules to the dot and followed all the rules that we set for her with, because rules are everything in Ayurveda, of course. So we spoke about that. We put her on medications, and we started one after a time. We started Basti for her. After that was done, her of course she had a little bit of thyroid dysfunction as well. That came down, which naturally reflected on her cycles. And it's been now 1.5 years. The fibroid hasn't increased in size one bit also. Not even 1 millimeter increase we have seen in the past 1.5 years over the multiple scans that we have done. And her cycle duration has reduced to 5 days plus 2 days of spotting. The pain is there but manageable. And whenever there is, it goes beyond limit, we do manage with emergency medications. But over the past 6 months, so it definitely hasn't happened. Now she is in her second round of Basti, and she is all excited about what she has done over the past 1.5 years with us, and she goes around talking to everybody about it. So the point is that this is one, because she's still under treatment, this is one of the cases that I really love talking about, because she has done something for herself, and it was definitely visible. It was visible with the scans that we saw. So this is one of it. So this is a complicated case for sure, definitely indicated for hysterectomy. And I would have suggested hysterectomy if the symptoms had not shown any kind of response, or if the fibroid was increasing in size. But fortunately, it all was manageable. So this is something that I'm pretty proud of her for what she did.
So, congratulations, Dr. Sharon, in this case. But I always say that um, it is very important the way the energy is put by an Ayurveda, whether in healing, curing their patient. The patient has to also understand and reciprocate with same kind of discipline, determination to cure themselves, because it is never one way. It has to be a two-way process. So I have a question now, and I would request Dr. Pankaj to start with it. So far, we have spoken about the positive side of Ayurveda in uh, caring, in giving the care treatment. But now, are there any limitations with Ayurvedic treatment? And one has to be cautious about it.
Yeah, definitely. Ayurveda also has its limitation, and being aware of it is more important than just experience like experimenting with things. Basically, so anything which is acute or life-threatening, suppose a heart attack or a fracture, basically. So you don't go to Ayurveda doctor for that, because definitely care definitely he can provide, but the actual cure is in emergency department. So as Dr. Shannon also said previously, that we need to collaborate and coordinate with each other and work in as a
Valid.
collective effort, considering a person as a whole. It doesn't matter whether it is allopathy, homeopathy, Ayurveda, naturopathy, physiotherapy, all these are for benefit of people. If everyone is individually giving some indications or guidelines to the person will eventually be confused only. And but if a team is working with in tandem with each other and complementing each other's shortcomings and good things to be implemented, so that is a better medical practice or medical system that any society can have. So, emergency conditions, some acute disorders, severe infections, kind of things, where there is a threat on the life. So, in that case, like a stroke or a heart attack, or maybe a joint dislocation or fracture, so in such cases, definitely Ayurveda has its shortcoming. It can give initial first aid kind of things, but the cure or saving life is in the emergency room itself, basically.
This is very well said, and it reminds me that during COVID, especially in Delhi region, we found a lot of hospitals were integrating allopathy and Ayurvedic treatment. So there were Ayush team, there were Ayurveda team, which were in-house with a lot of hospitals working with senior resident doctors and junior resident doctors in managing COVID symptoms, with taking care of it. So that was this is like system which was seen during COVID. I wish we had for all other diseases as well. Dr. Shan, can we hear something from you on the limitations part?
And the limitations, of course, there are limitations because of the history that Ayurveda has. So, it hasn't been very conducive to the growth of the science. So definitely we have limitations. But these limitations um, aren't really limitations if you consider that there are people who are working on covering up these limitations. Like, for instance, wherever we are lacking, there are people who are researching on that and somewhere else in the other segment, other allopathy science. So I wouldn't want to think of it as a limitation. It's just something that probably I don't have to do right now because there's somebody else working on it. And there are units, there are setups like we were saying fracture cannot be cured. Yeah, cannot be cured, but I've seen Ayurvedic doctors and allopathic doctors working together to work on that fracture and then ensure that that person gets back to their normal function again. Because once the surgery is over, the role of the ortho there is over. After that, the physiotherapist steps in. After that, the Ayurvedic doctor steps in. All of this is happening as a combination. So just saying only curing or stitching up that thing or tying up that or screwing it up together doesn't mean the management part is over there. So it's a combination that so if you say limitation, if you only want Ayurveda to wait and get to the point that modern medicine has gotten now, it's going to take a long time, but it's already there. So why? What's the need to do that? If it comes together, it's not a limitation anymore.
So, okay, fine, Dr. Sharon. I understand that here we are talking about combinations. But we have to also accept the reality that all the systems are running differently, right? And we need a bigger authority to bring it together. However, there are functionaries, there are authorities that are trying to bring together integrated healthcare system. But what happens is when a person suffers from any disease, any chronic issue, let's talk about cancer. If somebody is diagnosed with cancer, especially the first family becomes so desperate to get that person treated that they seek different kinds of treatments. So, if I ask you in one line or two line, or maybe to put it together, that what Ayurveda can do and what Ayurveda cannot do.
Okay. First thing, you said there is authorities that are required to bring this integration. Their doctors are enough to bring integration as well. So they, like I said, like we work with I work with allopathy OBG YN here. No, we do that, and I've seen surgeons working closely with allopathy surgeons as well. So just doctors coming together can also make a significant difference in the life of the patient. So that limitation part is handled there. But yes, this is a very important question that you asked about what Ayurveda can do and what Ayurveda cannot do. Because in many places, even Ayurvedic doctors do not understand that it is time to accept limitations and say no when they have to. So I would say that yes, when it comes to preventive wellness, we have everything with us. When it comes to management of pain, also we have solutions, but it is not. But it is definitely helpful in certain kind of pain, but not in all kinds of pain. But when it comes to anomalies, like instance, like for instance, structural pathologies, where you need to switch, surgery becomes the main line of management. That surgery only has to be done. Okay, there is a limitation. There is a, for instance, this fibroid that I spoke about. If this fibroid, which is indenting into the endometrial cavity, is definitely growing in size and the bleeding is continuing the same way consecutively, even when my treatment is going on, I must know to stop doing that. I must know to tell that patient, look, your vitals are falling, your HB is falling, there is no response in the size of the fibroid, let's get you operated. There has to be my limits there. So I would suggest for any patient that's looking for exclusive Ayurvedic management, uh, ensure that while you talk to the doctor, both allopathy, Ayurvedic, both doctors should be aware and inclusive. But your doctor also, Ayurvedic doctor also should be open to understanding what happens when the risk threshold is crossed. What happens when the risk threshold is crossed? Does he or she know what to do? Is there a plan of action there? Because there has to be a plan of action. It cannot be like I start treating, for instance, let's say a 35 or a 35 plus year or a 38-year-old comes to me for infertility management. I have to give her a time limit when I'm going to try Ayurvedic management. After that, if they really desperately want a child, I really have to start looking at other options for them. So your physician, both ways I suggest both of them should be open. But if you're talking about Ayurveda exclusively, your Ayurvedic doctor should have a plan of action. What happens after this? They should know to tell you. So that will kind of help you understand how prepared your physician is. And that will give you a heads up as to how far you can go with that physician. Same applies to allopathy medicine as well. But because we're discussing about Ayurveda, yeah.
So, Dr. Sharon, you are a good doctor because you are treating your patient as a project to cure them, to heal them, but not as a client who's coming. So, I have a question with you, Dr. Pankaj, now. Same that how do you see the limitations with Ayurveda? What Ayurveda can do and cannot do?
Yeah, definitely. As I said, limitations are there, and few things which needs to be handled as an emergency or an acute condition. Like Dr. Sharma also said, some things which needs to be operated or surgically removed from your system, or it is spoiling your entire energy balance. So that an Ayurvedic doctor also should understand its limitations and where to say and guide the patient to the right direction actually. It is very easy for a doctor to prescribe medications addressing the symptoms. It's a very easy job. But to understand the root cause, understand the imbalance, understand your own limitations, and understand the harm of your medicines also is very, very important. Because Ayurveda medicines also have side effects to them. It is not like it is everything is safe. Medicine is a medicine, whether it is a homeopathy, allopathy, or any Ayurveda medicine, basically. So if you are putting a patient on a medication, there should be a clear plan of action actually. So okay, this is the time frame which I am looking at, that results might start showing. If that is not happening, that means something somewhere is not correct and might need some advanced or modern intervention to benefit the patient. So goal is to benefit the patient. There is no competition between any pathies or any doctors altogether. Needs to be working in sync with each other. And rightly said, when it is all about management. So once you have addressed the emergency and acuteness of the ailment, then you move towards other like dimensions of healing or improving your quality of life.
Yes, yes, absolutely. And for that, we required awareness. And also, as a responsible doctor, how you said that it's our responsibility as a doctor to make sure to educate them what is next step. So, and that can only exist if you are responsible enough. You are not treating your patient as a client, but as a project to cure them, heal them. I have a last question with both of you that in a world where disease is becoming more complex, where not necessarily there are cure for the diseases, how can Ayurveda help us shift from just fighting illness to living with dignity, balance, and better quality of life? This is my last question before we close this IG live.
So uh, basically, Ayurveda, if you stick to a basic understanding of your body's energies and imbalances and the symptoms that are bothering you, basically, and follow a routine with proper eating patterns. Everything nowadays is some way or another way polluted, basically. So you are not living in a world where the air quality is extremely pure, the food quality is extremely pure, or even when the person who is cooking the food is not cooking with the love, pure energies, basically. So that all is affecting in some way or another to So sticking to a pattern, following dinacharya, rutucharya, taking care of yourself matters the most. And start early. Don't wait for things to happen and get complicated. When your body is indicating some symptoms or another symptom, address to it. That doesn't mean you should have some kind of panic or phobia or something like that. Awareness, mindfulness is more important. That okay, your body is telling you something, understand that, and take preventive measures towards it, basically, so that things doesn't get complicated.
Yes, doctor, but unfortunately, uh, it is very difficult to educate people in this fast forward life. Let's not complicate things. We have got this habit of procrastination. We will see, we will go and see the doctor. That's the major issue. So I completely agree with you that we have to be mindful of the symptoms. We have to be aware about that body symptoms, body signals, and make sure that we reach out to the treatment ASAP. Yes, Dr. Sharon, can we have a closing statement from you? Can you hear me, Dr. Sharon? You can't hear me? Dr. Pankaj, can I have thumbs up if you can hear me?
Yeah, yeah, I can hear you. I can hear you.
Uh, Dr. Sharon, are you there? We can see you, but
Sorry?
can you check your Bluetooth?
Okay,
So can you just start with the last question's answer?
okay. All right. Okay, fine. So, regarding that, I was the first thing that I would like to Ayurveda.
Mhm.
It's time to discuss the limitations of allopathy as well. Because most of the patients who come to me, some of them are referred by allopathy physicians. And the more that happens, I think we can definitely find relief to symptoms like endometriosis way earlier instead of allowing the patients to suffer. So definitely that's something that we can do. Secondly, what I would say is, Sir has already spoken about everything that Ayurveda has to offer. But I would like to say that, like you said, it's a fast-paced life. Saying no is going to be difficult to things. Like I want to have a late night party with my friends who are coming after a year. Ayurveda says don't sit up in the night and don't eat late in the night. It's going to be difficult for a regular person who's not really into Ayurveda, unlike us, to be able to follow that. And it's a life, human life. You live only once after all. So in such conditions, Ayurveda offers options like Panchakarma, which is an opportunity to hit the reset button to yourself. And it is a very structured conditioned, process where it allows your body to enter into a space of planned, organized fasting or planned, organized diet with certain procedures which involves cleansing of the upper gut, lower gut, and all that. So, if you're not able to consistently follow the Dinacharya Rutucharya processes, this is definitely an option. I rather suggest that everybody who's an adult, is should undergo Panchakarma for each of the doshas at least once in a year. So that's once in a year. So it's like a reset button for everybody. And in today's fast-paced life, if you're able to do that at least once a year, you can definitely keep a lot of disease conditions away. So if you can do this, and if you can do this with a good doctor, you should definitely get it done.
So, friends, as Dr. Sharon said, you need a vacation, an Ayurvedic vacation, where you go out, you get the Panch Karma done, you have a, a beautiful ecosystem around you so that all the six senses get relaxed. That's what Dr. Sharon is speaking about. So seek a good Ayurvedic treatment. We have our Vedas on board, Dr. Sharon Samuel, Dr. Pankaj Chansarkar. You can always reach out to them for any help. And thank you so much, Dr. Sharon. Thank you, Dr. Pankaj, for joining us. It was wonderful to have a conversation with you.
Thank you.
Thank you,
Thank you so much.
Shivani. Thank you, and thank you. You take so much passion in Ayurveda. I really love what you're doing. Thank you.
Thank you
Thank
so
you.
much. Yoga cannot exist without Ayurveda, dear. So it's hello, my yoga.
Yes, yes, definitely.
Thank Thank
All
you so
right.
much. Thank you for
Okay.
joining.